Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. Our membership drive is still on. I've extended it a couple of times in anticipation of the Food Over Medicine retreat, which is the beginning of May. I'll come back to that in a minute. But the way this works is that you, if you're never a member before, or you're coming back after a long time or upgrading your membership, we're going to give you a gift card for the amount of dues that you pay. So, for example, you could use that toward the Food Over Medicine retreat, our autoimmune summit, or you could listen to the recording of our cancer summit. We recorded that whole weekend in case you weren't able to join us. So if you're interested in that, send me an email. I'll be happy to send details to you. And I do hope you're all going to join us for the Food Over Medicine retreat. It's an annual event. It's May 2nd, 3rd, and a special session on the 4th. We're going to cover a lot of ground, the great protein debate by popular demand. I'm going to cover that because there's so much controversy about protein and so many different opinions. Supplements like omega-3, vitamin C, magnesium, and more. Cooking classes, menu plans, topics you've been asking about, like irritable bowel, gluten, glyphosate, inflammation. And then on Sunday night, this is a Friday, Saturday deal. And then on Sunday night, we're going to have a special 1-hour session on putting everything together that you learned into a plan so that you do something about what you learned. I did it sort of last minute last year, but this year we're planning on it because it worked out so well. People really appreciated the opportunity to make a plan for getting their health in order or taking it to a new level. Either one is great. So anyway, remember, if you join, for some people, this ends up being free. The whole weekend ends up being free. So if you want information, let me know. Send an email to pampopper@wellnessforum.com. All right, I have two topics to cover today. One is skin cancer, and the other has to do with some healthcare practices and healthcare policies and this is kind of mind-blowing, actually. I keep thinking I'm never going to be surprised about healthcare, and I keep ending up being surprised anyway. But let's just start with skin cancer. It's springtime. Soon people will be spending time outdoors. I'm sure as heck looking forward to it. So it's time for the medical profession to start scaring the heck out of people about skin cancer. Through the overdiagnosis of skin cancer, dermatologists have become some of the highest paid practice groups in the country. They make more on average than the average oncologist, and that's saying something. The advice given by experts on talk shows and news programs and newspapers and social media is stay out of the sun, use sunscreen anytime you leave your house, and tanning is dangerous. So staying pale and taking vitamin D pills is the prescription for health, according to these people. And don't forget, visit your doctor to be examined for suspicious spots and be diligent about scanning yourself so that any new moles can be spotted early and taken off by a doctor. So I'm going to give you both sides of this issue, what the various people are saying about it. So we'll start with the American Cancer Society, not necessarily my favorite group. The group estimates that there will be 104,960 new cases of melanoma diagnosed in 2025. According to David Whiteman, a medical epidemiologist in Australia, quote, "The numbers are staggering, and without significant intervention, they'll only get worse." He refers to it as an epidemic. Everything's an epidemic these days. And of course, the elderly, I'm included in this group, are at highest risk. And the reason is, according to him, cumulative exposure. More sun over many more years equals higher risk, the experts say. Now, the other side of the story, of course, there always is one. According to Josep Malvehi, a dermatologist in Spain, overdiagnosis is contributing to rising rates of melanoma. And he blames this on the very sophisticated diagnostic tools we're using that identify smaller and smaller and smaller abnormalities, many of which probably actually aren't abnormalities of concern. The breadth of the problem is incredible. A recent study published in JAMA Dermatology, which is a pretty conventional journal, estimated that 59% of melanoma diagnoses in white women and 60% in white men were overdiagnoses, and that data goes back to 2014. I have watched it get worse. I don't know what the number is right now. but it was, over half, you're more likely to be misdiagnosed or overdiagnosed than diagnosed with something real. It was true in 2014. It's even more true now. So what happens with overdiagnosis is you get overtreatment and then increased vigilance. You're a cancer patient who needs more diligence and vigilance in terms of spotting every little abnormality on your skin, and more overdiagnosis and more overtreatment results. It really is one of the best examples of how you get sucked into the medical mill. There is more to the story. My full lecture on the topic, I think, was about 3 hours long. Last year, we recorded it, and it's one of the things you can buy access to with your gift card if you decide to join Wellness Forum. A couple of quick announcements, and then we'll get into the next health-related topic. Our new bar, the Fruit and Nut Crunch Bar, will be ready to ship in just a few days. Everything takes longer than you think it's going to, but it is amazing. It contains many different types of dried fruit, walnuts, and it's delicious. We've been working on this since the beginning of the year, and just a shout out to Joanna Osborne in my office who developed it and nursed it through to the end, and we're just almost ready to ship. We're selling them by the box, a box of 6, and so you can call and place an order, because I know we're going to have back orders of these, because that's what happens when you introduce something new. So anyway, that's coming soon. And then I also want to issue a save the date for June 10th, 11th, and 12th. Last year, for the first time, I did a free healthcare for healthcare professionals boot camp, and I'm going to do it again, 3 hours per night. We're going to talk about everything from how to research, how to clinical skills, what to do with people who have multiple problems, and etc. And so mark those dates on your calendar. We want to help everybody out there who's trying to do the right thing do better at it. And we have enormous libraries and resources, and try to make as much of this as we can available for free. We have to charge for some stuff, but we make as much of it as we can available for free. And I'll also mention tomorrow and Thursday, we're going to be holding sessions on this great book, Follow the Science by Cheryl Atkinson. She's one of my favorite reporters. I don't think we're going to be able to do the workshops in 2 hours, because there is so much. I have a couple hundred slides based on the book, and great book, by the way. But one of the things, just to tease you a little bit about what we're going to talk about, she recorded in the book, or reported in the book, I should say, a discussion between a medical doctor and AI. And the medical doctor starts by asking questions of AI that he knows the answer to. So when AI responds inaccurately, he corrects it. And this dialogue is just fascinating. And I'm sharing that with you now because a lot of people have a lot of confidence in AI that I think is not warranted. And so you'll learn more about that tomorrow and Thursday if you're in our advanced study book club. But beware of AI when it comes to healthcare, or probably anything for that matter. All right, our second news item involves the details of a case pending in the United States Supreme Court, which reveals why healthcare is so expensive that much of what is mandated to be free and included in insurance plans is useless and harmful even. And this impacts all of us. This is one of these things that this lawsuit, we're not plaintiffs in it, but the outcome of it is impactful to all of us, which is why I decided that I'm going to report it to you. So the case is Kennedy versus Braidwood, and it involves Christian-owned businesses and 6 people in Texas who challenged the Affordable Care Act's requirement to cover preventive services. Now, I'll come back to the list, which I think will shock you a little bit, but the legal issue that the court is considering is whether the legal structure of the U.S. Preventive Services Task Force violates the Appointments Clause. So what is the Appointments Clause? Well, under that, U.S. officials can only be appointed by the president, subject to confirmation by the Senate. Members of the task force are not appointed this way. But the Affordable Care Act, Obamacare, requires all insurers, including private insurers like those who filed the lawsuit, to cover any preventive services recommended by the task force for free. The plaintiffs take issue with, for example, covering pre-exposure prophylaxis treatment for HIV on religious grounds. Now, the Fifth Circuit Court of Appeals affirmed the district court's decision that the requirements are unconstitutional, but only for the plaintiffs. The High Court will consider the legality of the requirement that all insurance plans cover all preventive services recommended by the the Affordable Care Act since 2010. That was when Obamacare was voted in. So here is what has to be free. People wonder, why are the insurance premiums so high? Why is healthcare so expensive? It's because of all the crap that we have to pay for that must be included. So let me give you some examples. So I already mentioned HIV prevention, right? Prophylaxis. Another one is lung cancer screening for high-risk patients. Well, that would be super swell if we had treatments that cured lung cancer, but we don't. Colorectal cancer screening for younger adults does not save lives. Statins to prevent cardiovascular disease, the number needed to treat is 400 for primary prevention. So we spend a lot of money on blood tests, and then we spend a lot of money on drugs that don't make any difference. Medications to prevent breast cancer. The first one approved was tamoxifen, which reduced the risk by 2.8% while increasing the risk for uterine cancer. Screening for prediabetes, which is a non-existent disease developed by the drug companies and the medical cabal. I mean, we've got prediabetes and prehypertension. The pre-diseases just herd more people into the need for treatment, and type 2 diabetes. A brief filed by the American Public Health Association in opposition to eliminating all of the free stuff listed some of the other stuff that would no longer be free that they're super concerned about. One is RSV, COVID-19 vaccines, and DTaP and hepatitis B vaccines for infants. Infants have a statistically 0 chance of dying from or becoming very sick from COVID-19. And I've never understood why hepatitis B shots were administered at birth. I know that needle sharing and sexual promiscuity in the nursery was a big problem, but it just seems like we could do something about that without putting another shot in these kids, right? Behavioral screening for children and adolescents, we see how well that has worked out, looking at how schools around the country have handled our young people. Blood pressure measurement, preeclampsia screening, maternal depression, and screening for drug and alcohol use during pregnancy, and RSV and COVID-19 vaccines for mothers-to-be. What the heck are we doing injecting this stuff into pregnant women? And we wonder why the society is so sick, right? So I think you could make a pretty good argument. I can. I mean, I could go into a whole lot more detail, but this isn't the right format for it. That much of this is not worth paying for, regardless of who's paying for it. But to force insurers and employers to pay for it, many of whom object to it on religious grounds, is just ridiculous. And this is why the system is so expensive. Most people don't benefit from most of this free stuff. And by the way, nothing's really free. We all know that. Somebody's paying for it, you and I. It's unsustainable. I mean, I said in my video a couple weeks ago, our system is collapsing in numerous ways, and one of them is financial. And this is just a great illustration why. And this is why insurance is so expensive and why our healthcare system as it is cannot be salvaged. We just need something new. And that's my whole plan, is just, we're going to grow until we can flip the switch to do something entirely different and outside of what currently exists. It's the only hope that we have for healthcare in this country. I just spoke, one last thing I'll add as a postscript to my video a couple of weeks ago. I spoke to somebody in New Zealand last week who was telling me about the New Zealand system, which is socialized. And I heard the same story that I hear about the UK system. You can't get in to see a doctor. There's no consistency of care. You never see the same doctor twice. If you have an emergency, you have to do private pay, which is ridiculously expensive, while the taxes are ridiculously expensive to pay for the care that you can't get. That's where we're going to end up if we don't do something about it. And these systems all over the world are going to end up bankrupt. They're careening there faster because they were socialized in the first place. So anyway, we need change in healthcare. And I'll come back to a positive note. The best thing you can do is not need the healthcare system. That's my goal, is to stay out of it. And you only stay out of it if you stay healthy. If you get sick, you have to interact with it. And if you and we're glad it's there when that happens, but so much of what people spend time in doctors' offices and hospitals for is preventable. So I'll come back to join us for the Food Over Medicine weekend. You'll learn more about how to prevent a disease and live to be 100 in a healthy state. And join Wellness Forum. That's another way to get great information ongoing. There's new stuff every single week at Wellness Forum to keep you in a healthy state. All right, that's it for today. If you're interested in anything I've had to say to you today or want more information, send me an email at pampopper@wellnessforum.com. Pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news. Thanks for watching.